Good afternoon. Thank you all for being here. Chairman Hewitt, supervisors, Mr. Tran, Mr. Van Wagenen. I'm Jen Cruikshank. I'm the CEO for RUHS Medical Center and Clinics, in case you didn't already know that. First, I want to take a moment to review why we're all here today. As our governing board for the Medical Center, you are responsible to oversee the work, that our work aligns with our mission, vision, values, and our strategic plans. You interact with us many times throughout the year, approving policies, budgets, purchases, evaluating our quality and safety, pushing our team to continually to strive to serve our patients and communities in even better ways. Twice per year, October and May, we take some time to step back and tie all of those moments together, the activities and the approvals, to provide you a bigger picture in order to support you as our governing board in helping to hold us accountable to serve our community even better. As you've heard throughout the years, especially the last 2.5, healthcare organizations face a growing number of challenges: inadequate reimbursement, complex funding structures, workforce and supply chain shortages, escalating costs for workforce, supply chain, and pharmaceuticals, continued pressure to improve quality and safety amidst declining funding, and burdensome state and federal regulatory mandates with exceptionally high patient volumes. Even amidst all of those challenges, your team at RUHS works really hard to deliver some amazing, amazing results. And I am honored to work with such an incredible team. And today is going to be a special day for you to hear some of those great things. Today you will see several key leaders in the room here to support really Dr. T, and really thank all of you for the support that you've provided us in helping to make the services that we can provide even better. You'll hear from Nicole Orr, our Executive Director over our Foundation and Marketing teams, Leah Patterson, our Chief Patient Care Director, and our Chief Nursing Officer, Dr. Arnold Tabeunca, our Chief Medical Officer, Janelle Morris, our Chief Operating Officer, and Dr. Dan Kim, our Chairman or President of our medical staff. We always have to stop and talk a little bit about the strategic initiatives set forth by Zari Sarafian in 2015. Rebranding, integrated delivery network, master plan, efficient high-quality care and service centered around the patient, and really built on financial sustainability. We all know RUHS is not a place of last resort. We provide exceptional, compassionate, high-quality care and service. We have data, awards, and accolades to support that. RUHS rises to any challenge put in our way and daily adapts our care and services to meet the needs of our community. And our community needs to know that, you all need to know that, and we should all stand behind that and be proud of it. Integrated delivery network, we know the days of siloed approach to care is not going to make a difference in the world that we live today. We know, you've heard from Dr. Leung about his whole person health score and the different dimensions that impact the community's wellness and the person's wellness. By integrating our care with behavioral health, we're improving health outcomes for people with severe mental disease and behavioral health disorders. We're partnering with public health, so we're connecting the moms that are getting WIC services to primary care and behavioral health services, dietitian care, nurse-family partnership, and housing, and really we're working with the rest of the county departments to help anybody standing in front of us connect to the care and services that they need. The master plan, over the last 3 years, our RUHS Med Center and clinics have been able to expand by 500,000 square feet to improve access to care and improve outcomes in people's neighborhoods. At the same time, our behavioral health team added about 300 beds in the last 2.5 years along the care continuum, which, for everyone's note, is likely more than all of the other counties across the state of California combined. This is all with the aim to improve access to care and service, stretch to do whatever it takes to serve this community. And last but not least, efficient, high-quality care and service. We aim to improve access to care. You've heard that loud and clear. We're going to do, and we always do, more with less. Our efforts have to be around improving efficiencies, improving outcomes, and organizing our care delivery system to help meet the needs of everybody that comes in our way. You'll hear more in the May meeting about our partnership with IEHP and how we're working with behavioral health, public health, the Med Center, and all of our clinics are working to help connect to IHP resources and leverage their strengths and talents in helping us to make a difference. Of course, this is all built around the patient. Now, I would like to take the opportunity to share a little bit more and maybe punish this man a little bit more. I want to share something near and dear to my heart, really integral to our strategy deployment, and maybe more importantly, as you've already heard, to the culture and the heart of RUHS. Dr. Tabuenca is passing the baton of Chief Medical Officer to Dr. Aleka Clark at the end of this calendar year, and he is assuming the Associate CMO role. He was originally planning to retire, but he has since decided that he's not quite ready for that, and when he came to me and talked to me a little bit about that, I celebrated. As we shared with more people, everybody else celebrated, because as you can see, he is beloved by our entire team. I must share it with you, you've already heard, it is an honor and a privilege to work alongside Dr. Tabuenca. He really is the epitome of a servant leader, one that hears all and advocates for every win-win solution that's possible. And if any of you know physicians, you know physicians come with traits or characteristics that make them successful people. Those traits might include them being very driven, or very passionate, or very knowledgeable, and equally skilled. As you can imagine, getting all of those physicians aligned around one vision might be a little bit of a challenge. And then you throw difficult Jen into the scenario and it gets a little harder. So some may call Dr. Tabuenca a master cat herder. I call him incredible. Now it's a privilege to share with you a video produced just a bit to show the heart of this humble and very driven man.
Dr. Tabuenca is probably one of the greatest leaders that I've ever worked with. Underneath his humility is it's really hard to get a sense of all the things that he's accomplished. I've been here 5.5 years, and I'm still learning about awards that he's gotten and books that he's published and accomplishments that he's had that he won't tell you.
You know, it's difficult to talk about myself, you know. My father was a surgeon, and my mom was a scrub nurse. So being a child, I thought, hey, I'm going to be a surgeon, I'm going to be a surgeon. I started in 1990 as a resident.
His father wanted him to be a missionary surgeon and had hoped that he would come to the United States and train and then, you know, go back and serve in an underserved community. And, you know, he really embraced Riverside County.
This is my mission field, so I'm a missionary surgeon and a missionary doctor at the county hospital at RUHS. And with time, with my dad becoming, you know, more and more familiar, you know, he was in peace that his son, you know, even though working in the US, you know, I was fulfilling a mission. This hospital was a safety net hospital to serve the underserved. Hey, we don't care if you have money or you don't have money. We are going to take care of you here.
I think one of the most important things with RUHS is our mission. First and foremost, provide excellent quality care to the people in this region. This is the culture that's established by our administrators and Arnold. It transcends down to the faculty and then down to the residents. And similarly, it transcends to the nursing staff and all support staff. This organization doesn't run just by physicians, as you know, it runs by a team of people.
Even though Dr. Tabuenca has served as our chief medical officer, you know, if you just ran into him in the hallway, you would never know that that's the position he's in.
Because he'll always point to the team. He'll even point back to you and give you credit for things that he did.
Medicine has become so complex that is not an individual enterprise anymore. Hopefully it was less of that in our hospital, but it was more an individual thing. But now it's not, hey, everybody's working for me. It's we are part of a team, and we're all working together. And I'm working for you as a nurse or, you know, as a technician.
It's impossible to recount all the things that Dr. Tabuenca has done to sort of help build up RUHS. But if you think about our graduate medical education programs, if you think about research and C-Corps,
he's helped build our academia here in all these programs. So there's all these young physicians that are training and learning here because of the groundwork that he laid.
All the physicians who are going to be homegrown and trained within this community, who are going to be serving us and the future patients and generations who live here, you can, circle back and say that he was instrumental to address the physician shortage in this area. This is why I say that everything that you see around you has been impacted and influenced and been flourished by his care, his love for this institution and this community.
I think Dr. Tabuenca is someone who teaches us all on a daily basis what it is to be humble, what it is to be compassionate, what it means to bring your best self forward, and what it means to, love people as they are. So I can't think of a better example of a human being, to lead us in this incredibly important work.
In terms of the growth of institution, our healthcare network, bringing nationally recognized, verified programs to this hospital that serves this community, and also training the future generations of doctors here would have not had happened. So his impact is monumental.
We as physicians, our nursing leadership, our frontline nurses, our doctors and residents and medical students, we've all been equally blessed by having him choose to spend his career here at Riverside County.
And one of the things that I always felt in different roles that I had, the real successful leader should be someone that when you retire or when you step down for that position, things do not go bad. Actually, things should go better, and somebody will end up doing a better job than you did. That should be the goal. I know that the hospital will move even to higher levels and continue to improve, and that will then fulfill the last part of my goal. Hey, when I'm not in this role, things should continue and do even better.
I was trying to wrap my head around, what he has done. And it basically came down to one sentence. He is RUHS.